So good morning. We're going to go ahead and get started. My name is Adrenia Tolliver. I work with the Virginia Department of Health with the Office of Emergency Preparedness. I'm one of the training coordinators, and I pretty much coordinate the training, statewide training for the MRC Corps volunteers. And so today we're offering a training titled COVID-19 Testing Operations Overview. And so just to give housekeeping notes out of the way before we start the presentation, just a reminder that all lines are muted. We will be using the chat box for that reason. So if you want to turn the chat box off, you can, but you may want to turn it back on, especially when we get to the Q&A session, which will be at the end. One of our SMEs, they are working the chat box. So if you do put a question in there, they will be able to see it and may address it or may hold it until the end of the presentation. Pretty much you want to stop showing your camera so all of us don't view, that's fine. You can just select that. At the bottom of your screen, you're going to have the option that says stop video. And if you select that, that will turn off your camera. So therefore we will not see your video, your face, okay? But just know if you are showing a video, everyone else is seeing it as well. So today we have two presenters, guest presenters. We have Dr. Brooke Rossheim. He's VDH, Public Health Physician Specialist, and he will introduce himself a little bit more. And then we also have Susie Trotter, who's the VDH COVID-19 Testing Project Manager. So again, if you have any questions, feel free to put those in the chat box and our presenters will address those shortly. Thank you, and sit back and I'll turn it over to Dr. Rossheim and I will stop sharing my screen. So therefore.
Okay, well, let me, first of all, I want to say thank you for having me here. I'm Brooke Rossheim. I'm a public health physician specialist for VDH, and let me see if I can get my slides up. And they were here a minute ago. Okay, give me 1 second. Wait, there they are. Hold on. Now, why don't, it's interesting. I have the slides, but I don't.
And sorry, I can continue to drive if you want me to, Dr. Rossheim. Just let me know.
Yeah, I guess for I would like to try to give it a try, but I may have to. Okay, let's go ahead and turn it over to you. And okay. I don't know why this particular screen is not showing up on the. It's not allowing me to share, but it's. Hold on, this will stop, but do you want to? Okay, so if you want to go ahead and go forward. So basically, well, first of all, can everybody hear me okay? Is that
we can.
That's it, okay, good deal. Okay, so if you want to go to the next slide. So what we're going to talk about today is point of care COVID-19 testing. So we're going to talk about the tests that are available, how they work, a little bit of history, and then obviously if you have questions, please feel free to write them down, put them in the chat log, and either I or Susie Trotter can get to them. So first of all, I want to start out with a brief history of SARS-CoV testing. So when the pandemic started in 2020, the main focus was on COVID-19 diagnostic testing. And so I think everybody got to know the term PCR because that was the most common test that was done and still is done for COVID-19. And I do want to throw some terminology at you to let you know what this means, because you're going to hear this terminology over and over again. So the terminology that we use is a molecular test, or what's also called a nucleic acid amplification test, or NAA test, okay, that is basically a PCR test is a type of molecular test. So a PCR test is a type of nucleic acid amplification test. What you do is you collect a specimen. So most of the time, this is going to be a nasal swab, or it might be, as people remember, the nasopharyngeal swab, where you insert the swab into the nose, you go to the back of the throat, you twirl the swab around a few times. And what you do in the lab with that swab is you amplify the RNA that's on the genetic material that is on that swab. So you amplify it, and then you test it to see if it is the RNA from the genetic material from the SARS-CoV-2 virus. If it is, then the report comes back and says, yes, the RNA from SARS-CoV-2 was detected. If it is not, then the report comes back and says, no, the RNA from SARS-CoV-2 was not detected. So just to give you a little bit of terminology, PCR is just one type of molecular or nucleic acid amplification test. There are others out there, but they're not used nearly as often as the PCR method. So anyway, in the beginning of the pandemic, basically what everybody wanted to know was just, do I have COVID? And so you had a ton of diagnostic testing that was done, and by far and away, the most common method was the PCR method, a molecular test. The FDA, the US Food and Drug Administration, issued literally hundreds of emergency use authorizations. So what that means is that the test is not officially approved by the FDA. What the FDA does is it gives it what is called emergency use authorization. So that is, we're in a time of an emergency. The FDA doesn't have the typical amount of time that it would need to approve a diagnostic test. So what FDA does is says, okay, based on the limited amount of data that we have, we believe that the benefit of this test is greater than any harm. We think it's going to work. And so therefore we give it an emergency use authorization. So really it's just what it says. It's under emergency use. FDA continues to give out emergency use authorizations. Those are still coming, new tests continue to come out. So what happens is we have all these PCR tests that are done. And then in May and July of 2020, we get the first COVID-19 antigen tests. And these come on the market, and these receive an FDA EUA, that's our abbreviation for emergency use authorization. And sometimes you'll hear these tests, the antigen tests, referred to as rapid tests, which is a little bit deceiving, as I'm going to tell you in a minute. So these rapid tests, these antigen tests, work a little bit differently. What they do, instead of looking for genetic material of the virus, what they look for is they look for proteins that are in the virus that sit right around the genetic material. So if you were to look at the virus, like a picture, or a diagram, you would see that the RNA is right in the middle, and right around that RNA is this kind of shell of proteins. And that is what these antigen tests look for, it's the shell proteins. It doesn't look for the actual genetic material. And so in, the first antigen test that came out required, you have your swabs, you collect your specimens. And then the first antigen test had some kind of a reader device. So you had a separate device. Usually it was small, maybe like the size of like a Walkman or something like that. That was a reader device that you would put the test into, and in a short amount of time, 15 minutes-ish, you get a test result. Well, what happens in August 2020 is when we get the first test that doesn't require a reader. And this is what's called a lateral flow antigen test. And this is the test that probably everybody now knows, which is the Abbott Binax Now COVID-19 antigen card. So this is the test where you basically you collect a specimen, you put it in the card. The card is like the size of a credit card. There is a test strip embedded in the card. You put your swab in there, you put some drops of reagent. The sample then wicks its way along the strip, and in 15 minutes, you get a positive or negative result, and there's no need for an analyzer device. So once the Abbott Binax Now came out, that was kind of a big step forward, because now we don't need a reader device any longer. So we can just bring literally a box of cards, reagents, swabs, and instructions with us, and we're ready to go. Okay, next slide. So I know that people have, concerns about antigen testing, and I will address those in a second. There are multiple benefits of antigen testing. So one is that the test can be done right at the point of care. So the test can be done right where the person is. So it doesn't have to be a send out. And that's a big, big help. The second thing is the test is CLIA waived. What that means is that this is a test, a lab test that can be done in an office setting, like a doctor's office, a nursing home, a long-term care facility, or any other kind of testing facility, as long as you have a CLIA waiver, which is easy to get. So basically, it's a simple test. It doesn't require a lot of equipment. The test, these antigen tests, for particularly the Binax Now and other tests that are like it, which are now available too, they're easy to perform. You can teach anybody to do these tests. You don't have to be a clinical person. You don't have to be a doctor, a nurse. You can teach people to do these. And the fourth thing is the results are available in about 15 minutes. There is one antigen test where the results are available in 10 minutes. So having the results available that fast allows you to make decisions about the patient very quickly and efficiently, as opposed to waiting for a send out test that you sent to an outside lab, and then that'll be back, the next day or maybe the day after that. And as people probably remember, in the summer of 2020, we had these very long wait times of a week or more. Well, if you're waiting that long, the test, to be honest, really isn't very useful by the time you get the result. So there are limitations of antigen testing. Antigen tests tend not to be quite as sensitive as PCR tests. So therefore, you do have the possibility that you're going to have more false negative results compared to PCR. So what that means is that the person actually has COVID, you test them by an antigen test, the test comes back negative, even though they do have COVID. And if you did a PCR test, which has a little bit better sensitivity, the PCR test would be positive. So there are some trade-offs between antigen testing and PCR testing. I am still a believer in antigen testing because it does have some definite uses where it's helpful. Next slide. So this is the last history slide. So in November 2020, what happens is we get the first emergency use authorization for a molecular test to be performed completely at home. So now, in addition to the antigen tests, which are these so-called rapid tests, now we've got rapid PCR that's available. And so the first one that comes available is the Lucira. It's called the Lucira COVID-19 all-in-one test kit. This is a prescription item. So the doctor writes for the test. The person gets the test sent to them. This test is designed to be completely done at home by the patient, and the person follows the directions to complete the test and get the result. So the Abbott Binax Now COVID-19 antigen card and the Lucira molecular test really do pave the way for at-home antigen and molecular tests. And then, as you can imagine, more companies enter this at-home test market. Next slide. So I want to talk a little bit about the term point of care lab testing, because this is essentially what we're talking about. So point of care lab testing is just what it says. You're doing lab testing where the patient is. The specimen is collected, the test is performed right there. And, point of care lab testing is commonly used, in doctor's offices. They do rapid flu tests, they do rapid strep tests, they do lots of other rapid tests. And that's different than conventional lab testing. Conventional lab testing is you get a specimen from the patient, you send it to an outside reference lab, the results are reported back to the ordering clinician. Now, we do point of care testing at medical offices all the time, but now we also have point of care testing that can be done at home. And a good example of this would be a urine pregnancy test, finger stick glucose testing, and now obviously COVID-19 tests. So these are tests that are now available for point of care use, either in a medical office or a testing setting or at home. The other term you're going to hear, and there's a lot of terminology, as you can tell, is self-administered test. I think that's kind of a good one because it describes exactly what these at-home COVID-19 point of care tests are. They are self-administered. So you're going to get the test, you're going to follow the instructions, and you're going to get a result. These point of care tests are easy to perform. The interesting thing about these point of care tests that are designed for at-home use is that all of them can also be used in a doctor's office. So that was something that FDA did. I'm not sure exactly what inspired that, but all these at-home tests can also be used in a doctor's office. You do need to have a CLIA certificate to do it. Now, one thing that people sometimes get confused by is there are point of care tests where the test is actually done at home. So the specimen's collected, the test is run right there, you're going to get a result at home. Then there are what are called home collection kits. And home collection kits are just that. They are just collection kits. So the person gets a kit in the mail, usually. They get a sample, which is usually a nasal swab, or sometimes it may be a saliva sample. They collect it, you package it back up, and then you mail it back to the reference lab. Now, a home collection kit, there's no testing that's done at home. So you just want to make sure that you get, you want to make sure that you get the right test. It can be easy for people to kind of, confuse a point of care test that's actually going to be done at home versus a home collection kit where you're simply collecting a sample and mailing it back to a lab. Point of care tests obviously have advantages and disadvantages. I won't go into all that here. That could be like a whole nother hour discussion. Next slide. So what types of tests do we have? And so we've already talked about some of these. We have the COVID-19 molecular test, and we've talked about an example is PCR testing. This is used to diagnose current COVID infection. And typically it's a nasal swab or saliva. The test looks for genetic material from the virus itself. And some of these molecular tests are point of care. There are tests that can be done right there in a doctor's office or right there at home. We have the antigen test, and the poster child for the antigen test is the Abbott Binax Now. This is also used to diagnose a current COVID infection. The nasal swab is our sample. We've already talked about how it works. I will tell you that most of these antigen tests, the great majority of them are designed to be point of care tests. They are designed to be either done in a medical office or they are designed for home use. There are a few antigen tests that are designed where you collect a swab and you send that swab to a reference lab. That is not the typical thing with antigen tests, though. That is the typical thing with PCR tests. With antigen tests, these are mostly designed for point of care use. And you're going to get your result back fast. And then we have antibody tests. Antibody tests are also known as serology tests. So these are blood tests that look for antibodies to the SARS-CoV-2 virus. And if antibodies are present, you can see on the slide, I've put it may in caps indicate past infection with COVID. I will tell you that most of these antibody tests are good and they deliver as promised. In the sense that if they are positive, it's indicative of past COVID infection. However, there is some possible cross-reactivity with other coronaviruses because there are multiple other coronaviruses that simply just cause the common cold. And it is just about every one of us has probably had one of these common coronaviruses. So it is possible, not likely, but possible that if an antibody test is positive, it may be because of cross-reactivity with a non-COVID-19 coronavirus, okay? So another thing that's important with antibody tests is antibody tests are not designed to diagnose current COVID infection. If you're looking for a diagnosis of current COVID infection, you need to use either a molecular test or an antigen test. Another thing with antibody tests, an antibody test does not tell you if you need to be immunized or not, okay? Basically, everybody needs to be immunized regardless of whether they are antibody positive, antibody negative. So, because again, we don't know if that, first of all, we don't know if that antibody is absolutely to COVID-19. Second, we don't know right now what a neutralizing level of antibody is. So we don't exactly know what level of antibodies you need to have. So everybody needs to be immunized. Next slide. So I want to talk about some of the tests and the way that these are meant to be used. And in this case, we're talking about self-administered tests. So these are tests that a patient would do themselves, and get a result. So the first test that we have is the single antigen test. This is a test that is done at one point in time. And this test is generally for symptomatic people within a specific time frame after the illness onset. And this is exactly what the Binax, the original Abbott Binax Now test is. The original Abbott Binax Now is a prescription item. It is meant for people who it's meant for people who the healthcare provider thinks have COVID, and it needs to be done within the first 7 days of symptom onset. Okay. Now, just, in medicine, we like to make things sometimes confusing. So there are exceptions to this. So the exception is the Illume. The Illume is an antigen test that is a little bit unique because the Illume is a single antigen test, but it can be used for people who are symptomatic or people who are asymptomatic. So, and we're going to get to a table in a few minutes that's going to go through all this. But one of the things when you're using any of these self-administered tests is you want to see what is this test labeled for? Who is this test meant for? Because they're not all meant for the same type of situation. So that is the single antigen test. The next test that we have is the single molecular test. And so that's a single point in time test, one test So this is like the Lucira that we talked about before. This test, the molecular one, is generally for symptomatic or asymptomatic people, or for people who have a reason to suspect COVID-19 infection, or people who have no reason to suspect COVID-19 infection. So you can see in the sub-bullet, I've put this test could be used on anybody. So it could be used on somebody who is symptomatic. It could be used on somebody who has no symptoms of COVID and just wants to get a test. And then it could also, and then let's look at the second part. It could be used on people who have a reason to suspect COVID-19 infection. So who would be somebody that we might suspect, let's say a person who has no symptoms, but they might have a reason that we might suspect COVID-19. Well, what about if I'm a close contact? What about if my best friend has COVID and I've been around my best friend and I have no symptoms of anything, but I know that that person has COVID. So in that case, if I'm a physician seeing me, I'm going to be suspicious of, and the CDC recommends that if you are close contact to somebody with COVID, you should get tested. So this test could be used for that reason. Now notice that the antigen test, the number one above, that's only for symptomatic people. Okay, so that's not the test for that situation. So this single molecular test can be used for, it's got a broader range of indications. The other thing about this single molecular test is you could have no reason to suspect COVID. So a person just comes in and says, I'm not a close contact. I haven't had any exposure to COVID. I have no symptoms of anything, but I just want to get tested. That's fine. The single molecular test would be a way to go. Now, just like everything, there are exceptions. This Lucira COVID-19 all-in-one test kit is the way that it was designed. It's only for symptomatic people. So again, this is where you have to look at the labels of these tests. Then the next test that we have is the serial antigen test. And this is a little bit different because this is 2 antigen tests that are done over 2 to 3 days. This test has a very broad indication. It's actually the same indication as the single molecular test. This can be used for symptomatic or asymptomatic people. It can be used for people who have a reason that you suspect COVID infection, or people who have no reason at all to suspect COVID infection. So with this serial antigen test, you're essentially getting 2 bites at the apple. So you're getting 2 antigen tests done kind of back to back, and that's where it really comes in handy. So next slide. And one of the things, so this is an article, this is from an online article that I pulled about 3 months ago, is these tests went over the counter. So now people can pick up over the counter at-home antigen tests. We know, they're out there, they're at, CVS, Walgreens, Walmart, Target. You can order them online. And these are, so Binax now, for example, has its own version of its over-the-counter test, and other companies also have their versions of these over-the-counter at-home antigen tests. Next slide. So the next few slides get into really to the nitty-gritty. So I won't go through all of this, but what I've done is I've given you tables of all of the self-administered molecular and antigen tests that are available right now that you can do at home. So this is the table. So right now there are 3 molecular tests that can be self-administered. And you can see the different columns. You've got the test manufacturer. You've got the brand name of the test. You've got the date that FDA gave the test its original emergency use authorization, what type of test it is. Is it an antigen test? Is it a molecular test? Is it a prescription or a non-prescription test? So RX versus non-RX. What kind of sample needs to be collected for this test? The age range of who can this test be used for? I've also given you the link to the most recent FDA emergency use authorization letter. And then a column that is very important is, who is this test meant for? So who is this test indicated for? The next column, can the test be mailed to the person's home? And then additional information. One of the things I've put in here is if you want more information about these tests. So one thing I would like to point out about these tests is I want you to look at the first row and the third row. So you see both of those are Lucira Health manufactured tests. But look at the bottom row. The name of the test is the Lucira COVID-19 all-in-one test kit. So this is the first molecular at-home test. This is one we talked about earlier. You can see it's a prescription item. And then if you go further over to the right, you'll see that this test is indicated for individuals suspected of having COVID. Okay, now I want you to go up to the top row, the Lucira Health. Now look at this test. This is the Lucira Check It COVID-19 test kit. You can see that it got its original EUA in April of 2021. It's a molecular test. This is now a non-prescription item. If you go further across, look at the age difference. Look at the age range. So for the bottom one, the prescription one, that is meant to be used for people who are 14 years old or greater. But in the Lucira Check It COVID-19 test kit, the one that is the non-prescription item, we can use that on people as young as 2. And look at the difference in the indication. Look at the top row. The indication is with or without COVID-19 symptoms, or an epidemiologic reason to suspect COVID. Now, one thing I will tell you is the first row and the third row, those are exactly the same tests. There's no difference between them, but they are labeled very differently. And this is what you need to look out for. The second row is the Q Health test. This is another over-the-counter test. Again, it has that very broad indication. It can be done with or without symptoms, or with or without an epi reason to suspect COVID. And next slide. Okay, so now we're going to talk about antigen tests. So we have 3 self-administered molecular tests. We have a total of 9 self-administered point-of-care antigen tests. So these are the 3 most recent ones that are available. You can see the Access Bio, and we've got 2 tests from OraSure. So the Access Bio is a serial antigen test. So this is going to be this is going to be a 2-pack. So the test is going to contain, the test kit is going to contain 2 swabs with instructions to you're going to take those 2 tests over a period of between 24 and 36 hours, and it varies by test manufacturer. But look at the test indication. If we look at that column, you can see the serial antigen test. It's got a very broad indication. We can use this with or without symptoms. We can use it with or without an epi reason. So we can use this on anybody. The OraSure, you can see that OraSure, it's the same test, but notice that they've labeled one of them differently from the other. If you look at the second row, the IntelliSwab COVID-19 Rapid Test RX, this is a single antigen test. This is prescription. This is, you can see, meant for people 15 years of age and older. Now look at the indication within the first 7 days of symptom onset. So can we use this test on an asymptomatic person who just wants to know what their COVID status is? No, that because this test is not meant for that. Now, look at the test below it, the OraSure IntelliSwab COVID-19 rapid test. Okay, this is a non-prescription product. This is a serial antigen test. And like the other serial antigen tests, it has a much broader scope of who you can use the test on. So we can use it on people with or without symptoms, with or without any kind of epi reason to suspect COVID, and that's fine. So this test, the OraSure, the serial antigen test, we can use that on anybody, whether we have a person with symptoms, without symptoms, person who has a reason to test, or a person who doesn't have any kind of reason that we would suspect COVID. Next slide. So these are the other 6 self-administered point-of-care antigen tests. I will not go through all of these. I'm going to, basically these, the top 3 rows are other serial antigen tests that are available. And for just like the other serial antigen tests that we saw, the test indication is broad. So you can see that. The ones below it, the 3 bottom rows, are single antigen tests. And remember, we talked about that the single antigen test is typically used for somebody who's got symptoms of COVID and has to be tested within X number of days after symptom onset. If you look at the 4th row, the Quidel, if you look at the 5th row, the Abbott Binax Now COVID-19 AG card home test, that's where those fall. Like we talked about before, the Illume is an antigen test, but look at the indication. The Illume has a very broad indication. It can be used in somebody with or without symptoms, or with or without a reason to suspect COVID. So the Illume is really an antigen test almost in a little class by itself because look at its indication. And the Illume is a single antigen test. The Illume is not a serial test. Next slide. So I do want to go through some common questions that we get about point of care COVID tests. So one of the things that comes up sometimes is, can a point of care molecular test like the Lucira be used as a confirmatory test for an antigen test? And the answer is that this is really not the intended use of a point of care molecular test. So what we say in our guidance at VDH is that if somebody has an antigen test done and that needs to be confirmed by a PCR test, we would prefer that be done as a lab-based test, not as a point of care test. Are antigen tests accurate? Yes, they are accurate, but it depends on the study. Some studies have shown, have shown not great results with antigen tests. I will tell you that the best use of the antigen test is in people who are symptomatic. That's where you're going to get the most accurate test results. Even though you see that antigen tests are that do have FDA's blessing for use in asymptomatic people, just like we saw in those previous slides, the best use is in people who are symptomatic. In general, when you look at the whole, as it turns out, most people who have an antigen test are probably not going to need a confirmatory molecular test, a confirmatory PCR test. Another question we get is, are point of care molecular tests like the Lucira as good as those done in a high complexity lab? I will say that based on one study that looked at one test, no, but it does vary by specific molecular test. And I will say that the overall answer to this question is yes. These point of care molecular tests have actually held up pretty well against their lab counterparts. So the answer is, for the most part, yes. The last thing I want to point out is that the specimen matters a great deal. So if you want to collect the specimen, okay, my computer just, okay. You want to collect the specimen. Now the screen has gone blank. This is
We can still hear you, Dr. Rossheim.
no, the only thing is I can't see.
Right.
Okay, all right, now the screen is back. I don't know why it's doing this. Okay, the specimen, you want to collect the specimen just like the manufacturer wants you to. That is how you will get the most accurate result. And FDA put out a bulletin about this because they really wanted people to know that. Next slide. So, okay, these are some helpful websites for point of care tests. A lot of these are FDA websites, 3 of them, 2 of them are VDH websites. These are all provide good information. Next slide. And I want to thank you for your attention during this presentation. I also want to thank you very much for your service during this pandemic. The MRC is, all of you are an invaluable resource for helping with this pandemic. We could not do what we do without your help, so I want to thank you. If you have questions, I see the chat looks like it's been pretty active. I will jump into the chat log. If you have questions later, please feel free to email testinginfo@vdh.virginia.gov, and thank you.
Hi there, Brooke. This is Susie Trotter. I'm not sure who's driving the slides. We've had an adventure this morning. Thank you very much. Wow, yeah, the chat is just dynamic. So
I've seen questions whizzing by like
right.
really fast.
Yeah, they've been excellent. And I turn it over to you to Dr. Rossheim. There were some definite scientific questions that beseech me. So appreciate everyone, everyone's attention, and really the chat proves how complex testing has become, and to think, you know, it's a thrill to actually be a part of the pandemic response, because this is novel. This has never occurred before. And a year ago, there were no testing modalities. It was very limited, and the turnaround time, our lab capacity, etc., was all in the news. So it has just blossomed, the amount of tests and resources available and lab capacity. But that being said, Brooke did an excellent job of explaining, you know, there are so many different tests. We can all agree that the PCR NP swab is the gold standard. However, there are many utilizations that can fit depending on the situation. So no matter what test is needed, it really needs guided by the healthcare provider to and the consumer to know what it is they want tested. I know there's a lot of questions in there about travel. Some of these over-the-counter tests have no reports. They have nothing you can show anybody. It's kind of like, I just kind of want to know myself, and I take it at home, and then I know something, not everything, but something. So what kind of report do you need? How fast do you need it? Added to, what does your clinical picture look like? Were you in contact with anybody? What are your risks? Have you been vaccinated, unvaccinated? And all of that put together epidemiologically, what does it look like in your community? Some of our communities are doing super and are able to mitigate and contain and don't have large transmission or outbreaks. Others have quite a bit of an outbreak. So it is very complex, but I'm pleased to present this next section that really kind of focuses in on, so what is the role of the MRC then? And like Brooke says, goodness, we couldn't have done this pandemic without our partners and the robust MRC. We're really lucky in the state of Virginia to have this organization within VDH, and from early testing to vaccination and now kind of back to testing. We really appreciate the support at all levels. So for those of you that this is your first training, that was quite comprehensive, but very good information to kind of tee us off. And so I'll go through the next slides and just kind of give you an overview. So what we support through the Virginia Department of Health, we have grant money through the CDC, and that is to support testing throughout the Commonwealth at communities. And so it looks a little different depending on the community. Basically, from the state office, we have set up a COVID-19 testing team. And the local health departments with their planners then in communication will notify us through a red cap process and say, hey, we would like to set up community testing events at different locations. We need your support. So our testing team at VDH has turnkey contracts. We'll hear that name. But basically what it means is vendor supported contracts. So what we've done is in turn utilize the funding we've gotten from the CDC and done private contracts with different vendors that will then go to the location, support testing as well as support. So they'll support sample collection as well as at times support the testing, whether they do it at their private lab or in partnership with our DCLS, our Division of Consolidated Lab Services, which is our state lab. We will coordinate that and be sure that the community testing then can occur. So as you see on the slide, prior to the event, as I mentioned, the local health department and the planners will contact us. We'll get them connected to the contract vendor. We'll get the date set up. We'll secure the lab, make sure that workforce is available, be sure the training has been accomplished, and then confirm that, yes, in fact, that date is good. We've got it set to go. And then advertising and communication at the local level can occur and folks will come. So at the event, let's say it's Sunday morning from 1 to 5 at a Lowe's parking lot, then the vendors will arrive prior to the posted time that the testing will occur, get it set up, start the action plan. There will always be a point person who is in charge. We encourage the local health department have a testing coordinator that will be there. Volunteers then will get their direction and communicate at the time of when we're going to go live, where everyone needs to be, whether it's at the registration desk or the specimen collection, traffic control, security, exit, all of the entire event will be laid out. So as I mentioned, the MRC volunteers then work with that testing lead at the location. So you all will get individual training, actually quite robust training through MRC. And then at the location, all of us get our role definition and assignment, where to stand, what's our shift, when is our break, how we enter, how we exit. So then you'll always have a point person at the event location to work with. As well, the specimen collection occurs at the event. Of course, that was the whole goal. And kits are typically prepackaged, and the kits will be the swabs. What is the testing modality at the time? Like Brooke had mentioned, is it point of care? Will we be doing the Binax Now cards, or will we be doing swabs that we put in vials and ship by courier back to a laboratory? All of that is determined prior to the event, so there's no decision point at that. It's more so which kit are we using and processing. And then, of course, the results post-event will be reported by the lab and vendor, both to the facility. At times we do go into, say there is an outbreak at a nursing home, and we need to run a testing event. We will get those results back to both the local health department and the point person of the facility who needs to know that knowledge. So that's just a basic overview of what a community testing operations looks like. And in the next slide, we'll show a little bit more specific. There's some wonderful pictures to give you an idea. These are mobile. They're anywhere from parking lot to inside a facility or under a tent. Basically, the modality will be chosen, kind of like what Brooke said. What do we need to know? What is the transmission rate? Is antigen good? Is PCR better? All of those decisions will be made by the leadership. And then the request will go in, and the state then will get the proper vendor to come to the site. So that is all chosen. What is key for the volunteer and for all of us working any testing event is the integrity of the test. As Brooke mentioned, our goal is to have specimen collection and the testing done with as much fidelity as possible, because the result of the test is dependent upon how it was collected and how it was tested. So super critical for all volunteers to understand the role at the time of specimen collection and then thus testing. So the next slide will show not only the specimen collection role, but just the flow of the event. They are open to local community members. They're organized by the local health department, but you can see in this picture, we have an ingress. So there's one way in and there's one way out. We do drive-throughs. They might be, in the vehicle. Persons never leave their car. And so along the station, they'll do the same thing. We do intake. We'll do the screening form. They need to fill out their demographics and some symptomology. They'll drive through to the next station where they'll actually get the specimen collection. And then they'll follow through to the exit and the egress. It's a little different with vaccine. Vaccine is kind of a one and done, but then you do need to stay into that isolation or the 15 to 20 minute stay in your car waiting for symptoms before you can drive off. When you're done with the testing, you do not need to wait. You can drive off. However, there will always be an exit station to assure that the person feels well. People can get symptomatic even with the swab, just in the nares. It is still a test and there is testing fears. So we'll always check to make sure that folks are good to go as they drive away. Next slide. We'll show you the picture on the left is what I was talking about, a drive-through experience. You can see the picture on the right. We've got our MRC volunteers working a desk. Again, it could be registration where folks come and fill out forms and then walk into the building to get testing. They do vary in size. We have everywhere from 50, 100, 200, 500. There's also mass testing events. What we've been seeing recently, there has been not less interest in testing. I can't say that. Everyone is still interested in testing, but vaccine is our #1 goal with prevention. And so those events have been larger, and what our testing events have turned out to be about 20 to 50 people in the communities. That being said, at any point in time, we could ramp up easily, and that is the beauty of having MRC. And trained individuals ready to go to support both either a vaccine event or testing event. Next slide. So as I mentioned, they could be walk up or drive up. Some require pre-registration. The goal of pre-registration, it's tricky to do. It's beautiful if it can happen, and those are best utilized at large events, but that gets them already in the system. Basically, they have you enter your name, you come up, you're already in the system. We don't have to input the data at that point. And the input, although it's not much, it's critical. How do you spell your name? What is your first name? What is your last name? What is the spelling? As you can imagine, there are many Susie Trotters actually in the system. There are a lot of Brent Smiths. A lot of times we'll need their middle initial, we'll need the date of birth inputted exactly as their date of birth is. All that then goes over to the laboratory, then that inputs that data, and one mistype of the last name or a hyphenation of a last name or a transcribed the date of birth will end up with an error, and that individual will not get their testing results. So it's critical. Pre-registration helps on that so that when the client comes to the event, we can verify the information. But registration does take a bit of time. And that's where when you see the long lines of people going to a testing event, that is at registration. The test itself is very quick. They go through that station quite rapidly, but at registration, it is the demographics that we need to collect. And it is critical because just the name itself will put an error for a test result, which we do not want to happen for many reasons, but especially for the client who needs to get their test results. So those will vary depending on the testing event you get assigned to. And the next slide, please. Again, they are planned and overseen typically by the local health emergency coordinator in conjunction with the local health department. As the test results roll back and get reporting back to the local health department, that's where the contact tracing, communication, and really the whole goal of containment, where we can stop transmission, get to the people that are infected, have communication, set up our isolation, quarantine processes, and really break the transmission and somehow get ahead of this pandemic. So there will always be that leadership at any testing event, both on-site and off-site, managing the whole event. Next slide. So in summary, and we'll be glad to take questions, we really appreciate all the questions that are rolling in there, but there are different testing platforms. There are different reasons to use the different testing platforms. Antigen is just as good as PCR molecular. It just depends, as Dr. Rossheim shared, the indication and the community transmission in the area. A lot of times the antigen testing can support, do we need to investigate further? So we'll use them for a screening test. If you turn a positive screening test, an antigen positive screening test, then that may indicate to the healthcare provider, then we need to investigate further with this family, what's going on, and then actually do a PCR test. So there is not necessarily a stop with an antigen test, but it does provide a good rapid assessment of what's going on in the community. So there will be different testing platforms. As an MRC volunteer at that event, really you just need to understand what is the test that's being used at this event, what is my role. Again, you'll get amazing amount of training through the MRC, and at the event they will have your assignment and verify what your role will be. Of course, if you're going to be a sample collector, there is training required, more specific than this overview. We do have videos and training online that we have built and worked with the MRC and our logistics coordinator, Susie Silverstein. So the MRC organization and within VDH has access to all of those, and we will get, you will have access to that for further in-depth training, especially if you're going to be a sample collector. And then again, just we could not have done this in the Commonwealth without this valuable service of the MRC. We are indebted to all those before you. Thank you to those that are still here that got called up initially, and appreciate all the new folks that stepped up and want to participate. We're not out of the woods. We're still working with this pandemic. It's different than what it was last year because we have so much testing capacity and we have vaccine. And we're still fighting the fight. So absolutely thank you for your service. Appreciate the opportunity to present today, and we'll be glad to take questions and work in the chat. Thanks so much.
So Susie and Dr. Rossheim, if you all have any questions that you want to, or feel like you may want to read out and answer that way, we have a little bit of time. We can do that as well.
Yeah, that will be helpful. There's quite a few questions, and some of them same theme. Can you share though how they get credit for this and how they will get the slides while we look at the chat real quick?
Yes, so I have actually put on the slide, there's a link that you will access. And when I stop sharing the slide, I can also put it in the chat box. I can't do both. It will ask you, the form will ask you for a private or a secret phrase for today's training. And so just put testing in that space for the secret phrase, and you will get a credit for today's attendance. We will also make available the recording. So today's training will be recorded, and the slide deck would also be available as well. Give us a little bit of time. It may take about a week or so to upload, edit, and so forth, but we will make that information available on the MRC training page. So you can just go there and you will find this information, but check back in probably about a week or so, and we should have the recorded presentation there with the slide deck as well.
Thank you. I'm seeing a little bit of questions about, I appreciate the question about PrepMod to access existing and new data. I know our IT family at BDH is working hard, especially on the vaccine side with PrepMod. Each lab has their own reporting process. And so we've been working collectively with them, including our state lab and the one lab process, in order to improve the reporting processes. The question about people being notified with their test result, if they're found positive, that is absolutely currently going on. We have an outreach going on to ramp back up staffing for contact tracing and contact investigators. So the positives are being called. We do call them all. The goal is to box it in, and we want to call them all within 24 hours. It can be challenging, and it's, there is some COVID fatigue going on out there. I'm not going to lie. Some people don't want to hear from us. So we are definitely making contact. Sometimes it's difficult to get them to answer us back. And sometimes it's difficult for them to share where they have been publicly or where they might have been in contact with folks. All the more reason for our mitigation efforts to continue. And for everyone, to be safe and have precautions and get vaccine. But yes, for positive COVID-19 tests, the local health department and the state will call for those positives. There's a lot of questions, Dr. Rossheim, a little concern about, false positives. Is that an issue? I think it kind of goes back, I'm guessing, when we use antigen tests, the best use of an antigen test is when there is high transmission, and that goes to the sensitivity. But can you speak to that, Dr. Rossheim, about false positives? I hope we didn't lose him.
Hope not. Let's see. We may have.
We may have. There's another, is MRC planning to ask for volunteers to staff testing clinics? I can say that's a definite yes. And I'll get back to the false positive, but there was another question about vaccine, which, although we are the testing unit, not the vaccine unit, I can certainly share that. And I appreciate the question. We're all it's just an amazing time to be in public health, folks. I can't share how much I appreciate you, but yes, the third dose is coming. Yes, we are in our strategy right now on how to set up those testing events. And again, we're in a different situation than we were even a year ago or 6 months ago, but pharmacies are our number one support stream. So they will also be working with the third dose. We'll also be having the EAU. We expect that to come for the fall for the ages 5 and above. So school vaccination should be around the corner as well. So for the false, should we worry about false positive? The worry would be, should we be concerned about that, would be what happened is, we've asked an individual to, if it's a false positive on an antigen, we've asked them to isolate for 10 days, and that puts them out of play. If it was in fact negative. The option with a false positive, though, is always to talk to the healthcare provider if it's an antigen test. If there's been no other reason, they haven't been out in the public, they've worn their mask, other reasons to no symptoms, you can always do the PCR test. I say you can always do that. Talk to your provider and your insurance provider. But with the Delta variant, what we're seeing is there are breakthrough infections. So the worst thing that could come from a false positive is that you do a repeat PCR. It'd be worse to get a false negative, because then we're walking out freely and still transmitting. So yes, confirm with a PCR.
Hello?
Hey, Dr. Rossheim.
Okay.
I
Can you
want,
hear me?
yeah, I can hear you. I wanted to lean on you for the sensitivity of tests, questions
Sure.
about those positive and negatives. And can I,
Okay.
real quick, while you get your thoughts, I do see a lot of questions there for testing the Afghan refugees that are coming through Dulles. That is a federal response. We at the state level and local level have been supporting testing since the first arrival, and we'll continue to do that. But yes, the federal contract will start on the 23rd. In the meantime, we have had MRC volunteers go to Dulles Airport and support our testing. So that has already been activated. So I don't think it would be for a new call up, I guess is the question. But thank you for that. And yes, stand by. It may grow. So thanks, Brooke. Off to you for testing sensitivity.
Okay. Well, first of all, I apologize. My computer decided that it needed to restart right in the middle of the Zoom call. And so now I've moved to a backup computer. I'm happy to take questions that you have. I'm good on time, so I'm here to. So just let me know. So you were asking about sensitivity of testing. Hello.
Yes, that was the question.
Okay. If you look at antigen testing, the sensitivity of antigen testing runs about 60 to 80%. Now that's not going to be every study. Some studies are going to be a little bit higher. Some studies are definitely going to be lower. If you look at PCR testing, the typical sensitivity would be somewhere in the probably 80 to 90-ish% range. That would be pretty typical with PCR. I will tell you that in terms of specificity, both tests, the antigen test and a PCR test or a molecular test, are both high specificity tests where we would expect to see specificity in the mid 90% range. I'm happy to take any other questions that people have. Like there have been.
Great. Yeah, I'm just perusing through it too, Brooke. Yes, to Amy Eckert, there is a need for contact tracing volunteers again. I have found a resurgence over the last week. I would connect with your local health department, but through MRC, and see where they are. They definitely need help. Thank you, Hope, for signing up to help Sunday. That is a one-time opportunity. Really appreciate the support to help the repatriation and testing for the refugees coming through.
One thing, can I jump in, Susie?
Sure.
One thing that I do want to say, there was a question about will vaccination affect an antibody result? The answer to that is possibly yes. That is something that, you know, we don't know a whole lot about, but I think it makes sense that if you have a vaccine that, you know, yes, that may turn an antibody test positive. Now, one thing that I do want to let people know is that vaccination will not affect either a PCR test or an antigen test. So that is something, if you're concerned that a vaccine will affect that, it should not. So that would not play into that. There was also a question about PPE. If you are somebody that is collecting specimens from a patient, so if you are the one doing the nasal swabbing, then you are going to need full PPE. So you are going, because you never know if the people you're going to swab, you know, they may be asymptomatic and have COVID. So what we would recommend is a N95 respirator if available. If that is not available, a well-fitting surgical mask is fine. We would recommend a face shield or goggles, eye goggles. Either one is fine. I tend to like the chemistry goggles. That's just the ones that I prefer. You would need gloves and a gown. So you would need the full PPE. Now, one thing that you can do, and one thing that is fine with testing is, particularly if you're using tests that just require a anterior nasal swab, so just a swab that goes right in the front of the nose, is people can swab themselves. So typically you can go down to the age of about, 14, 15, and people can swab themselves, and you just watch them, you stand 6 feet away while they do the swabbing, and you don't need to do that for them. That is perfectly fine. That is no problem with that. And so basically once they do the swab, then you can just basically they reach their arm out with the swab, you reach your arm out to take the swab. And in that case, then really in that case, as long as you're not going to be in the person's face doing the swabbing, really all you would need is, you probably wouldn't need the eye protection. The mask I would wear. The gown you probably don't need. So probably it would just be, gloves, mask, plus minus eye protection. There's a question about false positives. We know that false positives happen. They are not a tremendous problem. They're going to happen because with any kind of lab testing, you're going to, no matter what it is, you're going to have false positives and false negatives. So yes, false positives are there. We don't really consider that to be a kind of a big contributor.
There's also a question, Brooke. I think it's worth mentioning. The over-the-counter antigen test kits have 2 swabs. So the question is, what if you only do one? And basically then you're missing the opportunity to catch it because of the incubation period, right? You need to use both swabs.
That's right. That's correct, Susie. And so the thing is that this, if you're only doing one swab, then you're not following the package directions in terms of how this test is meant to be done. So it's just like in those tables where, you know, you want to make sure that you're using the test the way that it was designed to be used. So if you're doing these serial antigen tests, and probably the one that people know the best is the Abbott Binax Now Antigen Home Test. That is one that you can pick up at, you know, drugstores and Walmart and places, other places. So yeah, if you're only doing one of the two tests, then you're absolutely right. You could be missing, you know, you could be testing too early. And if you do that one test and it's too early in the sense that you don't have enough virus that is replicating, that is growing, then the test may not trip positive even though you are infected. And that's the whole idea of waiting those couple of extra days, because by the time those couple of extra days happen, now if you know you're going to have more virus, if you're infected, the virus will be replicating, growing, and it will probably trip the test positive. And that's the whole idea behind those tests, is to, you know, is basically so that you're further along in the illness where the test would be positive. Let's see.
There was a couple more questions about vaccine, and as my caveat is, I'm not the expert, but I do recommend for those that were in that high risk category to begin with on the first round, to definitely communicate with your healthcare provider. Go ahead and put a call in and ask them what the plan is so that you're on track. But I do know it will become more available for those at the high risk and those that were vaccinated first to get it through our partners. So there will be certainly more communication coming out about that, but definitely for high risk, call your healthcare provider and get on the list.
There is a question about, and this is a good point, about training for becoming a collector. And this brings up a good point, which is that for all of these, like if you are an MRC volunteer who's working at an event where there are, let's just say, for example, you know, Abbott Binax Now antigen cards that are being used as the test device. There is a training program that you have to go through. I will tell you that these companies that make these tests, like Abbott in particular, has a really nice program. It's online training. So if you go to the Abbott website, which is just www.abbott.com, you may have to do a little bit of looking around for the Binax Now training. They have training videos that will show you exactly how the test is done. And these are easy. All of these tests are easy to do, but you do have to be trained to perform them. I know at VDH we have a checklist that we run people through just to make sure that they're doing the test correctly. And one of the other things is there was an earlier question about a proctored test. And a proctored test is one where you've got somebody on a smartphone who's watching you do the test the whole way. So they're watching you. They may collect some information. They may ask you some questions, like medical questions about, you know, why do you want to be tested, stuff like that. The other thing they do is they will watch you collect the specimen. They'll watch you run the test. So a proctored test is a pretty good thing if you have, like if you want to use a self-test and you're not sure, you know, about just reading the directions, you know, in a booklet that comes with the test, or sometimes the directions come on a smartphone app. A proctored test is not a bad way to go. So those are out there as well. There are a couple of antigen tests that are proctored. And if you look at the table, I've put which ones are proctored.
And Brooke, I see another one too. If you don't mind, I'll just make a comment about antibody testing. I think the unique thing about a novel virus is that it's new. And so, you know, one of my favorite quotes from Dr. Osterholm, you know, is that we do corrected science through knowledge. And so we're still learning a lot about SARS-CoV-2 and coronavirus, COVID-19. So the antibody tests that we have now, whether it shows up or doesn't show up in your blood sample, all it says really is that your body was exposed to something and did something, but it doesn't tell you that you are immune, that you won't get sick or you will get sick. We don't know. We just don't know. You know, that's part of the beauty of this job, you know, is research, science, and patients. Not only the patients that subject themselves to our care, but patients within ourselves. We're still learning. So our respected research science body has said, you know, the antibody test is not a green light for any of us. It just is one other thing, one other indicator. So we're not at the place where our goal is to get vaccination or disease so we get a positive immunity from this virus. We're not going to see that. And it's kind of like with any disease, like hepatitis B, your titers will wane and you'll have to get another booster shot. So we're still learning. So I saw a lot of comments about the antibody testing. We're just not going to see that as a green light yet. It's too early for that. I wouldn't put my money on those cards that the antibody testing is telling me that I am not going to get sick. So just wanted to share that as kind of, it is a very confusing science right now. Some people do get the antibodies in their blood, some people don't. And we're still learning. So mitigation itself is a very important, testing is just but a resource, just a layer of prevention. Mitigation is still our number one defense, you know, staying out of large areas, wearing your mask, washing your hands, getting your vaccination. Testing isn't the answer. It's just a layer of prevention so that we can get an indication of where the disease is, whether it's in an individual or a community. So we're still learning, and I promise you I'm going to read this book when the pandemic's over, because it's been an amazing run for sure.
So there was a question about are people who test at home asked or required to report their test result to the local health department? That's a really good question, and it's actually a little bit of a complicated issue. I'll make it a little simpler here, because what happens with some of these home tests, some of the home tests basically have a built-in mechanism where they will automatically report to public health. Now, some home tests do not have a built-in mechanism to report to public health. I will tell you that, you know, according to sort of my understanding of sort of the official sort of, you know, the law about this, I do not believe that there is any law that says that a home test must be reported to public health. There certainly is a law that says if you are a testing site, so if you have a CLIA certificate, if you're a doctor's office, yes, those people they have to report their results. Labs, you know, like LabCorp, Quest, all these other places, they definitely all report. So what public health has been doing, and what FDA has been doing on a bigger scale from being on some calls with them, is they are really encouraging these at-home test manufacturers, if possible, to build in ways to report to public health, because certainly we would like to get those results. And as the person who asked the question noted, that those results go into the calculations of, percent positivity, and those, we want to make sure those numbers have as much integrity as possible. So the answer to that question is, some do, some automatically report, but some do not report. And in those that don't report, what you will typically see in the package instructions is that they will ask that you report the test result to your doctor, whether it's positive or negative. Obviously, if it's positive, that's more important to report than negative, but negative is still important. So this is still an emerging area, because what we're seeing is that more and more of these tests are being kind of hooked up to the internet. And when you're hooked up to the internet, then it becomes easier for there to be automatic reporting to public health.
And Brooke, there was another one. I know we're running a little short on time, but I think we missed the opportunity to explain the difference between antigen and antibody.
Okay. So an antigen is basically like a molecule, a protein, a something that a test would look for. Okay, so for instance, in this case, like the COVID-19 antigen tests look for those proteins that are inside the virus that sit around the RNA, the genetic material in the virus. That's what all of these antigen tests look for. Now, an antibody is something that the body would produce in response to, anything foreign. So for instance, like a virus, like the COVID virus, the SARS-CoV-2 virus. So an antibody is typically detected via a blood test, because that's where, antibodies, circulate freely in the blood. Antibodies, when you take somebody's blood, you can basically, you can spin the blood down, and you can basically, you can do testing looking specifically for different kinds of antibodies. So for instance, you mentioned like hepatitis B, for example. So, one of the things for healthcare workers is that, everybody wants to know if you've had a hepatitis B vaccine, and that's really easy to find because you simply just do a test looking for the antibody to hepatitis B. If people have antibodies to hepatitis B in a sufficient quantity, then we can determine if they're immune or not. So that's the difference. And Susie, your point is well taken with regard to antibodies for COVID, that we are nowhere near that stage with COVID where we know we have no idea what amount of antibodies is sufficient to be considered immune to COVID. And I think it'll be a little bit of time before we even get to that stage, because that can take a while. So that's the difference between an antigen and an antibody. Let's see.
There was a question about testing after vaccination. How soon after full vaccination can you see positive COVID test result for those being tested for symptoms? Now, we don't recommend, if I remember correctly, Brooke, is it a 90-day window after you've had a positive test that we wouldn't retest because you were still in convalescence? It would still be positive, but I don't know about vaccination.
Vaccination. Your first answer is right, that if you're somebody who has had COVID, okay, if you've had the illness and you've got the test to document the fact that you had COVID, then it is not recommended, at least under usual circumstances, it is not recommended that you get retested within 3 months because we know you're going to be positive. So for example, a situation may arise. This is like a situation that sometimes we get asked. So, if I'm somebody that has had COVID and I got better, I recovered, and so now, I know I had COVID because I've got the, test to prove it, and I had symptoms and I got better and I'm now back at baseline. And what happens is, so, that was 2 months ago, and I am exposed to somebody, my next door neighbor who I know has COVID, and I'm exposed to my next door neighbor. So I'm over at my next door neighbor's place, and I'm there for more than 15 minutes. And after 20 minutes, the neighbor says, "Oh yeah, by the way, I forgot to tell you I have COVID." Do I need to do anything? And the answer to that question is no, because there's no this is the one exception that CDC has, is that if you had COVID, you recovered, you have a test to prove that you had COVID, you are asymptomatic, then you basically fall into the exception. You don't need to test, you don't need to quarantine, because it is very unlikely, because first of all, your test is going to be positive. And the bigger thing is that it's very unlikely that anybody is going to get reinfected within the first 90 days after COVID infection. And that's why we don't even recommend that those people need to quarantine. Now, if somebody gets, very sick, something like that, then all bets are off, because then you want to look to see what's going on. But again, if you're asymptomatic, close contact, you had COVID within 3 months, there's no need to test, no need to quarantine. And then you had another thing is with regard to testing after, with regard to testing and vaccination. A vaccine will not affect a COVID-19 PCR test, and it will not affect a COVID-19 antigen test. We get that question a lot, is people wondering whether their tests are going to be affected by a vaccine, and the answer is no. So here's another example. And this is one that we're seeing now with Delta. Let's say that you are somebody who is fully vaccinated, so you got your 2 doses of Moderna or Pfizer. It's been more than 2 weeks after. You got a single dose of the J&J vaccine. It's been more than 2 weeks. And now you start so you're fully vaccinated, but now you start developing COVID-like symptoms. So you develop a little cough, you develop a runny nose, you develop a sore throat. Should you get tested? Absolutely yes. Okay, because remember that anybody, regardless of vaccination, who has COVID-like symptoms, and that could be the mildest of sore throats, that could be the mildest of runny nose. The severity really does not matter. You should get tested. And the thing is, the fact that you are fully vaccinated will not affect the test result. And one of the things that we're seeing, is I'm sure everybody is reading about, is breakthrough cases in people who are fully vaccinated with one of the 3 vaccines that's that is has an EUA in the US, and that's because of Delta. And Delta is more. We know Delta is more contagious. We know Delta produces higher levels of virus that are in people's specimens. And so, with Delta, even though somebody's fully vaccinated, it just may be the amount of Delta virus that they have may just be a little bit too much than protection than that vaccine can provide in that person. And vaccination is different from person to person. Some people get a tremendous immune response. Some people get a little bit less of an immune response. So it really depends upon the dose of virus that you're exposed to, and how much immunity do you have from immunization. You know, most people that are immunocompetent, as we put it, that people that have a normal functioning immune system, when they come into contact with Delta, you know, they're going to be fine. They're not going to have a breakthrough case. Some people are, and the thing is, we expect breakthrough cases. We know we expect that with any kind of vaccine, because we know that no vaccine is perfect. But the thing is that the odds are really way on your side that either you won't get sick at all, you won't get infected because you're vaccinated, or if you have a breakthrough case, what happens is that these breakthrough cases tend to be milder in their severity. And so what happens is, you know, you don't see people you know, ending up in intensive care and things like that. You tend to see these milder cases with breakthrough infection.
Thanks, Brooke. I saw there's a lot of questions about, you know, travel and which test, and Abbott, you know, the point of care Binax now, there is the self test that's over the counter for $23.99, but it does not meet the CDC testing requirements to enter the US when returning from a trip abroad. However, I do believe most pharmacies, and it's worth the ask, behind the counter, you can purchase the proctored Binax Now test. And that is the one that if you look up, you know, if you look up American Airlines or you look up Delta, they actually have a link to what tests are approved. I think cruise lines do as well. So it would be very difficult for us to comment as far as which test to go get, because there is a timeliness manner as well as a reporting function. But Abbott, like Brooke showed, there's 5 different Binax Nows in some hybrid form or another. So definitely talk to your pharmacist that you need the one that has the reporting function for travel, and be sure you know what the airlines or cruise line wants. There was another comment I was really excited to see. I think Phyllis put it in there that Walgreens has started the 3rd vaccine for those age 75 and older. And she made note that they also gave flu shot at the same time. And it asked, is that standard? I know this is off of testing, but we highly encourage flu vaccines as well, especially this year, like every year. But I don't know, Brooke, do you have any awareness if those 2 vaccines at the same time are contraindicated or a good idea?
No, that is a good idea. And CDC has come out and said that co-administration of COVID vaccine with the standard flu shot, that's the inactivated flu vaccine, the killed vaccine, that's fine. So for that kind of co-administration, yes. What I don't know about is the flu mist. So for people, the flu mist is the live attenuated, so it's a weakened live flu virus vaccine that goes, it's a spray up the nose. I would have to look that one up to see what the story is about co-administration of a COVID vaccine with the flu mist, the live attenuated influenza vaccine. But co-administration with a flu shot is fine, and not only fine, but as you said, it's encouraged. So because you know, we want to we want everybody to get a flu shot, just like we want everybody to get their COVID vaccine.